Hello, everyone. It's great to be here today presenting at the ICAM conference. I'm Brontë, and I'm a research assistant at the University of Glasgow, and I'm joined today by Mike, co-founder and director of Dog Rescue. And we're going to be speaking on dog neutering campaigns in Thailand and evaluating their impact, in particular looking at Dog's work and setting this in the larger context of the ICAM University of Glasgow Assessment, Monitoring, and Evaluation Project. So I'm going to give a brief overview of our assessment, monitoring, and evaluation project. Mike's going to jump in with a bit about Dog, their work, and how they evaluate it. I'm going to touch on a bit of the analysis, and then we're both going to come in and discuss some of our key findings and takeaways from the process. So starting off with an overview of our assessment, monitoring, and evaluation project. So this project came out of a place of recognizing that there's a big gap in the available and published evidence of how to evaluate effectively dog population management, and needing to have more of these resources to be able to support DPM practitioners. So from this, we developed this project where we're working with a number of dog population management focused organizations to help identify the priority impacts of their work, their activities, and how they can effectively measure these impacts. And we do this by supporting organizations with data collection, data evaluation, and then also disseminating their findings and sharing those. Currently, we have a number of organizations that we are working with. Beyond Dog in Thailand, we also have projects on the go in Sri Lanka, India, Georgia, and Greece, and several more in development. So at the very center of our AME, our assessment, monitoring, and evaluation process, is this evaluability assessment process. So this is really at the heart of the project, and it's a collaborative way of quickly and systematically looking at how a project can be evaluated, and if so, how we can do that. It's focused around a theory of change, looking through an organization's activities, interventions they're doing, through to the outputs, outcomes, and the major long-term impact. And this is focused around looking at the goals of those interventions and working together with all the stakeholders and all the interests involved to really determine the impact that these activities want to make. And it's based on existing research and data sources available. And we work through this process outlined in the image below across a number of meetings and workshops, moving through the process of planning and developing that theory of change, all the way through to prioritizing outcomes, and then looking at how we can evaluate moving forward. So I'm going to turn it over now to Mike to talk a bit more about his work.
Thanks, Brontë. Yeah, I'm Mike from Dog Rescue. I'm the co-founder and director, and I'm based out on the ground in Thailand out here. So Dog Rescue was started in 2018, and we're based in rural Thailand. We're in a province called Nakhon Nayok, which is about 2 hours northeast of Bangkok. And our main activities include CNVR, which is capture, neuter, vaccinate, and release, also known as sterilization and vaccination, emergency rescue for sick and injured dogs that we encounter, community outreach and education, and shelter and adoption work. So to give you a little bit of background, you might not be familiar with the Thai context. So Thailand's free roaming dog population includes many different dynamics to that dog population, which includes stray dogs, which is the kind of feral dogs that live mostly by themselves. Then you have the community-owned population. So they might be dogs that are living alongside people in communities and villages. They might be being fed regularly by a person or more than one person on a regular basis. They might even sleep on people's properties, but they're not owned by a single person. And then you have owned roaming dogs. So they're dogs that will be claimed by a person in the village. They will say that they own that dog. They might be wearing a collar, but they are completely free roaming. They're not confined within someone's garden or compound. So obviously, they are part of the problem of the overpopulation because they engage in breeding activity, procreation. You also have owned confined dogs as part of that population dynamic, but we focus on those slightly less, obviously, because they tend to be not so much a part of the problem. So the ownership is often quite blurred. So many dogs are informally cared for by local people. And I think generally dogs are very well tolerated in Thailand. People like dogs, they're kind towards them, but the conflicts arise around unchecked population growth. There's a stat that's often quoted here that there's a very high mortality rate, especially among puppies, of around 80%. So disease, malnutrition, car accident, puppies often don't make it to adulthood. So that's obviously a very big part of the problem, and also nuisance behavior. So dogs rifling through rubbish, chasing motorbikes, biting people, killing people's livestock. All of those nuisance behaviors come from the overpopulation of dogs. So like I said, many dogs will receive food and kindness, but it kind of falls apart when you get to veterinary care. So even providing very simple medicine to keep fleas and ticks at bay, preventing blood parasites, that's really where the community isn't always able to step in. So Dry Dog's approach, we have to work within that context, and we always remain culturally sensitive to all of those variations within the population dynamics in Thailand. Let's talk a little bit about the main part of our project is to try to reduce the overpopulation of stray and community dogs in Thailand. So focusing on the province that we're in, which is Nakhon Nayok. So we started this dog population management project in 2022. Interestingly, we didn't used to call it dog population management. We used to call it CNVR because we had a slightly unsophisticated way of looking at the whole thing. So sterilization and vaccination was our primary piece of work. But now we look at this very much through a lens of a holistic dog population management project. So we started out with the 5-year project goal of sustainably reducing dog populations and improving the relationships between dogs and the communities in Nakhon Nayok. So just to talk a little bit about the work with theory of change. So we had started working on theory of change a little bit before this AME project started, the Assessment, Monitoring and Evaluation project started with ICAM and University of Glasgow, but we'd only really touched on it. And one of the first things that we did as part of this process was to really make a really well-defined theory of change for our project. So as you can see from the diagram, we took that from the activities that we engage in, so that's CMVR, schools education, community outreach, advocacy, human behaviour change, through to rescue, integrated rescue and welfare services. So looking at the outputs of all those activities and the outcomes of those outputs, right through to the impact we hope to finally have, which is the improved lives for dogs and communities. And just to say as well that as an organisation, we used to be quite focused on outputs. So we used to talk a lot about how many dogs we'd sterilised, how many dogs we'd vaccinated. So we were focused quite heavily on numbers as opposed to focusing on the outcomes of those activities. So improved dog health, reduction in dog populations, improved relationships in communities. So for me, that's been one of the really key learnings from this whole process is the shift in mindset from looking purely at outputs to more of an outcome focus. And then just talk about some of the tools that we use. So again, as part of this process, we really looked at how we were gathering data. We've always been quite good at capturing data, clinical data, but we really now have quite a sophisticated system for measuring impact. So we now use the ICAM Talea app for doing site surveys. So when we go into a new area, we'll always do a baseline pre-survey. So we'll try to establish what the situation looks like before we start an intervention. So that's going out in the mornings and counting the number of dogs that we see on the street, whether they're sterilised or unsterilised, whether they're wearing a collar, if they're puppies or lactating females. So those indicators help us to assess the population and what stage it's at. That's been really helpful. And then we follow up, and a year later, we do an annual follow-up to those Talea apps. We follow the same route and we go and recount the dogs, see if there's been a change in the dog population, see if there's been a change in the percentage of sterilised dogs, and look at those indicators again, look at the number of lactating females, look at the number of puppies. And that's been really key for helping us to see the impact that we're having. And then the other tool which we're using, which is completely new to us and we weren't using before at all before we started this process, is the CAP surveying. So that's the knowledge, attitude and practice survey. So we completed our first CAP survey in conjunction with the ICAM and University of Glasgow team last year. So they helped us to design the questions and make sure that the questions were really well written and they captured all the relevant details. So we surveyed 300 respondents across 2 completely separate districts. So one of those districts had been receiving CMVR intervention for the past 4 years, and the other district hadn't had any CMVR intervention at all. So we looked at the differences in people's knowledge, people's attitude, and people's practices. And as Brontë will go into, there was quite a significant shift across those 2 districts.
All right, thank you so much, Mike. So now I'm going to jump into a bit more of that data analysis. So from the evaluation assessment process, we walked through those workshops with JIDOG, we were able to identify several priority outcomes that we wanted to look at. So first was changes in the density of free-roaming dogs, the probability a dog was sterilized, as well as whether they were a lactating female or puppy, and whether the dog was sick. So we looked at all of these factors in association with the sterilization effort, the number of sterilizations that have been happening at both the mobile clinics on location in subdistricts, as well as the permanent JIDOG clinic, to get an idea for the CNVR effort, and then these changes in the population and with the dogs. So this analysis was all focused on the province of Nakhon Nayok, as Mike has been discussing. In particular, I'll be talking a bit more about some specific areas. So in our site surveys, we focused on the subdistricts where the JIDOG team has been working the longest. So that's Kokorat and Hachang. And then with the CAP surveys, we had the intervention area where JIDOG has been working for several years in Pak Phli, the light blue there. And then we have our control on Karak, where there hasn't been any work. So those are the main areas we're focusing on with our analysis. So now looking at those priority outcomes. First, we have dog density. So JIDOG's work was associated with a significant decline in dog density over time in both the subdistricts we looked at. In Kokorat, for example, before JIDOG's intervention, there were about 10 dogs per kilometer sighted. After 3 years, that was going all the way down to 7 dogs per kilometer. So that shows that not only is there a sustained decline, but that continues across time. And this is reflected in the CAP surveys. So when we look at people's perceptions, respondents in the intervention area were more likely to perceive a greater decrease in the number of dogs on their street. They had more of a positive opinion of the dogs on their street, and they were less likely to report being troubled by dogs with those nuisance behaviors over the last 12 months. So then our next priority outcome was looking at sterilization status. So once again, we found a positive association with a decline in increase in dogs' likelihood of being sterilized in association with JIDOG's sterilization effort. And this was compounded across years. So we looked at sterilization effort on an annual basis, and we found that all years had a compounding important effect on the probability that a dog would be sterilized, with the amount of sterilizations 1 year ago being the strongest association. This was once again reflected in the CAP survey. So respondents in the intervention area were more likely to be supportive of CNVR as their preferred method for managing the free-roaming dog population. And likewise, dog owners in the intervention area reported higher sterilization rates in their dogs as compared to the control. Finally, when we look at the population structure, we also find that there's a decline in the likelihood that a dog was a puppy across time since the peak of GI dog intervention in the area. Although puppies were a very small percentage of the population, there was still a significant association with the probability of being a puppy before the intervention being about 0.09, and then further declining for after 3 years to 0.01 probability that a dog observed on the site surveys would be a puppy. So overall, these findings show us that the impact of GI dogs' work can be reflected not only in the site surveys, in the dogs we see on the street, but also in the CAP surveys, in people's perceptions and their practices in the everyday. And this is shown in the decline in dog density, the increase in the probability the dog is sterilized, and a decrease in the probability that a dog is a puppy. We didn't find an effect in relation to the prevalence of lactating females or the health status of a dog. These were very small components of our sample. We didn't have a very large percentage to get an effect out of this. And we also just looked at health status on a binary sick or healthy level based on observations of dogs. So that might have also affected our ability to get a trend in that regard. I'm going to turn it over now to Mike for some final takeaways and reflections on being part of this process.
Great, thank you. So as you can see, there's some really interesting findings and statistics in there and data, and it's really helped us to become much more sophisticated in the way we look at impact assessment. So before we started this process, we had a fairly underdeveloped theory of change. We were using very basic population monitoring techniques focused on outputs as opposed to outcomes, and we hadn't really got into CAP surveying yet. So there's been quite a fundamental shift for us in looking at the project as not just a sterilisation and vaccination project, but as the holistic dog population management intervention now. So, and I think when you're thinking about doing things like human behaviour change or advocacy, having access to this data is really important, because when you're talking to local government officials or even communities, being able to prove to them through data and show them interesting analytics and data and on how there's been a shift in reduction in nuisance behaviour, for example, or reductions in the instance of dog bites in the area, those things really resonate with people. So yes, I wanted to just say that it's been really fundamental for us in the way that we look at the whole project. So now we have a really fully developed theory of change, more sophisticated impact assessment strategy, including the Talia app and the CAP surveys, and that shift in mindset. So I think I would highly recommend any organisation that's been operating for a couple of years to go through this process, because having access to the brilliant teams at University of Glasgow and ICANN was really transformational for us. And it helps you step away a little bit from the operational focus and really start thinking about this, very important data side of things.
All right, perfect. Thank you so much, Mike. And I want to thank everybody for tuning in to our session today. We look forward to speaking with you further in the Q&A. And if you want to learn more about our AME project, I encourage you to check out my colleague Danny Anderson's presentation, where she's looking at her analysis with help and suffering on the same project. So thank you so much. And that's us.
Yeah, thanks everyone.